and for the closing address to this fantastic day. I mean, just really superb presentations. We've learned a lot. I think a lot of ideas have spread, certainly the session that I chaired this afternoon. Lots of ideas that can be used elsewhere from really hard-working innovators. Where it did work, Brian. Oh. But it gives me great pleasure to introduce the Minister for Mental Health, the Minister for Healthy Lifestyles, Minister for Western New South Wales, the Honourable Kevin Humphries.
Thank you, Norman, and thank you everybody for being here. I'd just like to acknowledge a couple of people before I begin. The symposium that we attended last year has virtually doubled in presence this year. And I think the quality of the projects that we've seen exhibited here today, and despite the debate, which was more an evangelical presentation, I thought, on a number of fronts, the commitment that Gillian Skinner has made to innovation and the commitment to reform in New South Wales, I think is outstanding. And Gillian, I'd just like to thank you and your team, and Mary and your team, for allowing these symposiums to continue to grow. That's not happening in every state or in every other jurisdiction. And the fact that the Premier was here this morning also, I believe, gives testament to our understanding as a government to the important work that you all do. So I'd just like to acknowledge those two people, because I've got to say we've got a pretty fantastic team, and to see the families that were here on the stage before, that's what it's all about. It's dealing with simple and complex issues, how we basically translate all the work that you do in your everyday work, whether it be small or big. There's no size in innovation. That's the important thing. It doesn't matter how big it is or how small it is. If it leads to change and improvement in quality of health care, fantastic, and we saw that here this afternoon. I think it's important that we remind ourselves, what is our everyday task, and that's to improve the lives of people in New South Wales and indeed in this country. So thank you on behalf of the Premier. He asked me to pass those congratulations on to you as well. New South Wales has thousands of community health centres. We've got 234 hospitals, and I think there are close on 1,000 people that have attended here today. Where do the people of New South Wales see you and the work that you do, whether it was the ambulance service? I notice you're in good hands there, Gillian. Whether it's the ambulance service right through to our tertiary clinicians. Well, I can tell you, if you survey the people in New South Wales and ask them what's important to them, in the top three, virtually in every case, it will be all about health services, access to health services, and making sure that people pretty much get real-time service. And that's the challenge for us. Living in a 24-hour world today has created a whole lot more demands on services, not just in health, but right across all aspects of our society. And the fact that the IT platform changes every 3 years, it's outstanding that here we are in a health system which really, in terms of the buildings and the infrastructure, haven't changed a lot, but I can tell you what goes on inside significantly has, and more importantly, what goes on outside that infrastructure has changed to meet those demands that we're facing today. So the other chance was to say thank you for the work that you're doing, because change is reflection. It's a reflection of innovation and reform. Change does not happen by accident, and certainly systemic change doesn't. 100,000 people work for New South Wales Health. It's one of the largest health jurisdictions in the Commonwealth. To actually harness innovation and bring about systemic change which leads to quality improvement is no mean feat. It's often about leadership, it's often about planning. Our leaders aren't necessarily our best innovators, but our good leaders recognise innovation and they promote those people within our local health districts and indeed within our communities. I think the variation, clinical variation, Brian, if I could use your concept there, which I firmly believe in, given that I live in a pretty varied part of the world out in northwest New South Wales, I think it's important that we have a closer look at innovation and reform. It's important that we gather together, and where I saw the word connecting minds resonates for me, because as the mental health minister, I'm often asked to describe what mental illness or mental unwellness, if that's a term, is all about. And I describe it very simply as a state of being disconnected. And people that become mentally unwell generally, I know there are more complex cases, are disconnected usually from their families, from their workplaces, from their peers, from their social context, from their workplace. They can at times be disconnected from their clinicians and sometimes disconnected, unfortunately, from their medication, which tends to lead to complications. People were not born to live in isolation. It is very difficult to innovate in isolation. And I think the context of this symposium is very, very important, because if we don't come together at a local level, at a regional level and at a macro level like this and celebrate what we do and share what we do, innovation, I can tell you, gets lost. And we've got some sensational innovators, not just in health, but in health in particular, as we've seen today. It's our job, and Gillian and my job, and Barry's and everybody else in those positions, to make sure that those people do not become disconnected, that they have those conversations, that the questions that they're raising have the opportunity to be answered. And I suspect for innovators in this room today, there are still many, many questions we haven't even thought of. So the human condition will live on in terms of innovation, and it's why people in our community have a very high expectation of what we do. People become unwell. They want an answer. They want to get well quickly. And some of you have heard me talk about the temples to immortality, those hospitals on the hill that they drive past every day, and they know that when they get sick, they can get in there and they'll be out and cured of all ills. We know that's not the case. And when you're trying to drive community mental health and community health responses, that's a big issue for us in terms of where we put our resources. My job's to keep people out of those temples to immortality, and Gillian does a very good job once they're getting in there to do the best that we can and the best you can. And I've got to say you do a damn good job on behalf of the people of New South Wales. So we're happy to stand with you when the good stories are there, but when things don't go so well, and we're allowed to, and as someone said before, I think Norman, we do have permission to not get it right all the time. Be assured we'll stand beside you when that happens as well. Just in terms of today and the summary, I think the innovation that we've seen today, and certainly the People's Choice, fantastic, is representative of what's going on in innovation in health in New South Wales. And whether it was the fat yabs from Menindee looking at new ways to get people involved in chronic disease management, through to phone apps and how you can access clinical trials, or really discussing how patients can and should be at the centre of all care and how we respond to that, I think it's an outstanding testament to the growth in this symposium. I just wanted to step back a bit, because I actually changed my presentation or the closing, because I think it's in the context of what's been discussed today, and it's not all about Aboriginal health, but I actually have carriage of Aboriginal health, and Kerry Chant does a wonderful job and with the support of Mary. But if I can just have the first slide, please. So I want to talk about quickly innovation. It's behind me, fantastic. That is a century old. It's over a century old. Chronic disease, and how do we respond to it? And this is part of the Healthy Lifestyles portfolio, I suppose, but in general. 20% of my electorate is Aboriginal. Western New South Wales, it's a far, far higher percentage. There are 73 discrete missions or closed communities across New South Wales, and many of those people were gathered into those settings well over a century ago. One of the oldest is in my area, and it's the Brewarrina mission in northwest New South Wales, and it really came to the fore in the late 1880s, 1890s. People, in short, came and were harnessed from a traditional lifestyle of high protein diets. If you have a look at what's a basic ration that started in this context, the 1880s, might be a little bit later than that, of this group of people that lived in far northwest New South Wales, look at the diet. You've gone from a high protein diet to a diet based on flour, sugar, a little bit of tea, tobacco. Cakes and figs are tobacco. They're not cakes as we know it, and it's not figs as we understand it. And these gentlemen would have been all part of a clan. Notice there are no women there as well. And obviously some of those men worked harder, or they had a higher status, and there was some beef in there. Up until, and I'm 53, some of the people I went to school with were not allowed into my town in Moree. They lived in segregated schools, and right up until the 70s, pretty much existed on not too different a diet. The only different thing is that there's not alcohol in there, and that came later. But what I wanted to say is, at the time, well-meaning people had a highly innovative idea to say, let's make life easier for these people. Let's bring them into missions, let's feed them up, let's give them shelter and give them blankets. In effect, what we did through that innovation was put these people on a fast track to chronic disease. I don't need beds in Western New South Wales, I need dialysis chairs. So 100 years later, what was perceived to be an innovation and probably a very paternalistic male view of health has led to quite an epidemic that continues to grow. Now, if I go into South-West Sydney, as Gillian knows, and it's no accident that South-West Sydney is the office and hosts the Office of Preventative Health, it's not too much different. Now, we know better today, but on one hand, we're still treating a chronic disease that continues to emerge by what was perceived to be innovative practice not that long ago, going back to the 1880s and the 1890s. If we can just go to the next slide. Here's the counterintuitive thing. A lot of people think in places like Wilcannia, even Broken Hill, Bourke, Walgett, or South-West Sydney, I'm talking about places there like Minto, Macquarie Fields, around in Mount Druitt, that there are no fresh fruit and vegetables. In fact, there are, and a dietitian friend of mine has done a study on the prices of fresh fruit and vegetables in Bourke and Walgett, where dialysis or diabetes is out of control, versus the processed foods. You would think that in those places that fresh fruit and vegetables, the prices are astronomical. It's absolutely the opposite. It is cheaper to buy fresh fruit and vegetables in Walgett and in Bourke than it is to buy processed foods. And you say, why? Well, I can tell you the answer. Because the demand for processed foods is greater. So supermarkets price their product based on demand. If you went into the eastern suburbs or the North Shore or some of our more affluent regional centres, the price reflection would be the opposite. Fresh fruit and vegetables would be more expensive and processed foods would be cheaper. So you get this counterintuitive view of life and how we respond to it. We do have fresh fruit and vegetables in those places, but because of the behavioural trends that we've inculcated into those communities, it's the norm to consume processed foods, and that's reflected in the market. If we can just go to the next slide, the last slide. What innovation is happening today, and is it happening inside our hospitals to deal with this issue? To an extent it is, but I can say there's some pretty exciting things happen. I'm up to about my 20th community garden, I think, that we've opened out there in the West. And there's a great partnership between New South Wales Health, our Medicare locals, some of the non-government providers, our schools, and just interested community people who have recognised that if we do not take a population response to this issue, and if we don't take a response or create a response in terms of behavioural change, and in effect innovate back to what we know is right, we will continue to see an increasing trend in diabetes. So it is no accident that community gardens are growing. And a lot of people think a community garden is just a tank in the backyard and it's something warm and fuzzy that you do. But if you combine community gardens with an education process in supplementing fresh fruit and vegetables, which is what's happening in a lot of those communities, in partnership with ourselves, the federal agencies and community, you will start to see change. So I suppose my response to innovation is living in a remote area, it's not always about the whiz-bang innovation. It's about going back to grassroots things that we know that work. It's about encouraging the leadership to change the way that we do things that in many ways are common sense. And I'd like to encourage people to question what they do, to question why we have rampant chronic disease, not just in remote communities but in our metropolitan areas, and look at how we can encourage people. We can encourage people to actually change their ways. And healthy lifestyles, as Barry said this morning, is largely all about behavioural change. So it's not about warm and fuzzy, it's about really making that difference in people's lives and how we can stimulate that. My last comment is, if you went to, and I'm going to say, because I told him I was going to talk about it before, and that's the issue of clinical variation, and Brian has spoken about it before. And it's something I believe in quite seriously, because it doesn't matter where you live in New South Wales, you should have access to reasonably similar care. And it's not about geographic isolation. I can be isolated in the middle of the city here and still not have access to care. It's my wife telling me, I think, who's sitting down the front, that my time's up. But at times, she doesn't come with me often, but she's sitting right behind you guys. And she cheered loudly for the ladies, so yeah, I knew we were done there, sorry guys. But the last comment is, at times you have to centralise something to make sure that everybody's got access to the service. And I just wanted to thank the people in New South Wales Health that have been involved in a couple of programs in the last 12 months, and Gillian's support, and that's for the outreach perinatal service for young mums, because in some of our areas we don't have those, that base of clinical expertise. But I can tell you through innovation, particularly through telepsychiatry and telehealth, it works, and it provides support to our outreach staff, but most importantly, it gives them the confidence to deal with the issues that they're facing on the ground. And the other one that we recently were involved in, and that was the eating disorders program. Not all our areas have the capability of dealing with those issues. So whilst we have local decision making, and we'll continue to drive that and back what you do, at times we've got to bring that service out from a central agency to provide outreach, to provide in-reach, and make sure that people, not just the consumer or the patient, but also our staff, to some expertise. So thank you for what you're doing, just the complex nature of innovation. But I can tell you it is leading to better outcomes. And at the end of the day, I can tell you the people of New South Wales have a very, very high regard for New South Wales Health and the network that not only you are building and creating and growing, but we will continue to work and grow into the future. So thank you, Norman. Thank you for what you do. Terrific presentations by all those people that were involved in those awards. Many of you will be there tonight, and I'd like to congratulate you, and on behalf of the government, thank you for being here today.
Good presentation. Well done. Right. Yeah, that's great. Thanks very much. Thank you, Minister. In a moment or two, our word cloud, is it there? Yep, is coming up. These are the thoughts that you've had, George, that you've had as takeaways from this meeting, this great day. It doesn't happen by chance. I want you to join me in congratulating and thanking the groups from, I'm sure lots of groups from the Ministry of Health, Deb Hyland's team, and the other teams who've been brought into this. They've worked incredibly hard for a long time to make this such a professional day and such a success. Please join me in thanking all the people here. Please go safely, and thank you very much for attending.